Hi, this is Travis with another video for you guys. So I'm a doctor of physical therapy, also been a personal trainer about 15 years now. And so the topic of today is going to be knee pain. I know there's already a lot of content that's out there on knee pain. So I'm going to give you my 2 cents on it. Not to say that I'm going to totally reinvent the wheel here, but I want to just show you guys where to start. Specifically, I'm going to be talking about more general knee pain though. There's a lot of different types of knee pain that are out there. You're always going to want to get checked out when in doubt. There can be some things that can masquerade as knee pain that are coming from your back and whatnot. So I'll be giving my 2 cents on all that at the end, but for those of you with more minor knee pain, you can go ahead and grab a mat and we'll get started. Now you can also add a mini band, which is one of these small loop bands, into the mixture and put it around the top of your knees to make these glute exercises a little bit harder. You can definitely check out my leg. I have a mini band leg workout video that's got some pretty cool tips on how to use one of these guys. And since glute weakness is so strongly implicated in knee pain, I would encourage you to try to strengthen your hips as much as possible. Okay, so as far as where to start, so if you've got a lot of knee pain and it's pretty hard to do a lot of things with it, you want to start typically in a position where you're not actually standing on it and compressing the knee together. Now the knee's actually 2 joints really. It's the joint that interfaces between the 2 long bones here, which is your tibia and femur, and so we call that your tibial-femoral joint. And then we also have the one that sits right behind your kneecap here, which we call your patellofemoral joint. And so different things are going to cause different problems in each one, potentially. And so many times though, many people have more problems where your meniscus is. Now sometimes though, runners and people that spend a lot of time on their forefeet can irritate more of this patellar tendon area, or patellar ligament as they often call it now. People can get pain sometimes on the side of their knee, sort of coming from that IT band. Many times though, that IT band stuff comes from glute weakness and glute instability, so I'll be talking a little bit about that. But gentle range of motion and isometrics can be an easy place to start. So looking at range of motion, now a real simple way to do that could be laying on your back. And I showed this in my sciatica video, but it can also work for knee pain. And so you would just lay down with something that slides pretty easily and just do some gentle range of motion, or what we call heel slides. Now you don't necessarily have to use one of these sliders. I wouldn't buy one if you don't already have one. If you have hardwood flooring, you could use a sock. Sometimes certain types of bed sheets might slide a little bit easier. So, all I'm doing is just sliding my heel back and forth. Now, if going all the way back here hurts my knee, then obviously I'm not going to go there. You can just kind of work a window that feels, tolerable. And so again, when I'm bringing this thing back, I get a little hamstring work. As I'm pushing it out, I get a little bit of quadriceps. So you're actually getting the muscles on both sides of the fence here in the thigh. So just a pretty gentle way to start with some easy range of motion. Now, as far as isometrics go, the simplest place to start is to do what we call a quad set. And for that, all you're going to do is just try to make a muscle with that quad. You're just going to try to flex and squeeze that thigh, almost like if you're pushing the back of your knee down into the mattress of the bed or the mat, whatever you're laying on. So you can just push it down, hold for about a second or two, and then relax, push it down, and then relax, okay? And you can do that for a set until you feel a little fatigue. Ideally, you want to feel just muscle working, not a lot of pain in the knee. Pushing down as hard as you can gives you some pain. Just try to get a contraction to where you're getting a little bit of that pumping and squeezing, and that's fine. Now, for some people to get a sense of this, putting a towel roll behind your knee can be helpful, and then kind of like you're trying to smash that towel roll with your thigh. So that helps you to kind of see what you're doing, and if you can't really feel a good contraction there. For certain types of knee pain, that quadricep muscle can get kind of inhibited. So having something back here can kind of help you to feel that contraction and kind of see that muscle ball up a little bit more. So sometimes that towel roll can be a useful thing to do. Okay, so building on this concept of isometrics, if you were to hold that contraction now, instead of just kind of pushing and then relaxing, you can do is hold that to where I've got that contracted state in my leg, and then I lift it up. This one can be a little bit limiting sometimes if you're already sitting down, especially if your hamstrings are kind of short. So you can certainly lay down on your back for this one. So you're just going to push the back of that knee down, hold that tension and lift up. And this is the one we call a straight leg raise here. So, you can bring it all the way back down if that feels okay on your back, or you can kind of work a little bit of a narrower window here. And so you're getting isometric quadriceps down here. You're also getting some hip flexors in this area up here, okay, kind of more by your hip, okay? Now you can take that and you can also do it on your side. So I'm going to show the other leg now. So if I were to roll on my side, again, hold that quadricep contraction, and now lift my leg out to the side. And that would be a fine variation to do as well. Just try to keep your hips pretty much stacked. If you want to bring that other leg back, just keep those hips stacked on top of each other. And you can just do kind of a straight set here. You could even roll over a little bit, go back. Just trying to not let your pelvis rotate a lot, but that could be a nice way to get some isometric quads while I'm now getting into that glutes and the hips. And so some of you might remember this variation from the glute video that I posted, so you can check that out as well to see some other progressions. But that's isometric quadriceps with a little bit of hip, either straight to the side or to the side and back. Okay, so hip strengthening can definitely be an important part of rehabbing a knee, and a lot of the instability that puts extra stress on the knee many times comes from hip weakness. And so hip bridging is a fantastic exercise, and so there's nothing too fancy about this one. You would just, for some people, bending their knees too far back might be problematic, so you can play around with your foot spacing. Just find a place that feels somewhat comfortable for your knee, and all you're gonna do is lift up your hips, okay? And so this is one of those tried and true exercises. Again, you don't have to go up to where your back is super arched, just to where you're sort of in a straight line, relatively. Just a good contraction in the glutes, holding for about a second or so, then coming back down, okay? And so that's a great way to get some strength in the glute muscles. That shouldn't put too much strain on the knee typically. If it does, you can actually elevate your feet on something with your legs straight. So if you happen to have one of these balls laying around, these stability balls or Swiss balls as they call them, you can lay down with your legs on this, okay? So this way you don't have to flex your knees as much. And then, you can decide how far or how close you kind of want the ball. And then from there, you would just lift your hips off the ground that way, okay? And this doesn't even have to be a ball per se. If you had a bed or something you could put your feet up on, that would work as well if you're laying on the floor in front of it. But the ball just tends to work pretty nice in this case if you happen to have one. And again, you can see if I move the ball back, you can certainly try it from there versus trying it out here a little more. Now you actually are asking your knee stabilizers to kick in a little bit more, but your range of motion won't be quite as high, but that's okay. So either one of those variations could certainly work. And many people will see things where you're doing a bridge in this position as well. So, you could actually do the bridge here to make it a little bit harder, or you could do like a hamstring curl, with a bridge. And those are also great exercises. They're a little more advanced though, so if you're still in that early phase of having some knee pain, I probably wouldn't go to all that just yet. I would start with the easier ones. Ideally you always want to get your baseline pain down, so if your day-to-day pain is still pretty high, I wouldn't start adding on really advanced exercises. I would just do some simpler things, and then once your day-to-day pain is getting pretty well controlled, then you can start to test the waters a little bit with some of the more advanced exercises. So that's just there for you to show how you can do a bridge with your legs a little straighter, and then also to show how you can do some progressions if you happen to have one of these balls laying around. Okay, so now if we're going to start to get into a little bit of movement at the knee joint instead of just stabilizing there, what you can do is put something in the back of it, and I'm using a foam roller, but you could certainly just fold up a pillow or some towels and that would work as well. And from there we could do what we call a short arc quad, okay? And so that's just a limited range of motion exercise for the knee. Not moving real far. Obviously, the bigger this thing is, though, the more range of motion I would get. So, this could certainly be a pretty small thing. It doesn't have to be really large. And definitely, you could do this laying down as well as sitting up. And quite frankly, it's probably almost easier if you're laying down and doing this. And so, kind of like that other one, you just squeeze for a second and then relax. Squeeze for a second and then relax. And that's the short arc quad. Now, the way to progress that could be to not use the bolster at all. And some of you might remember this from my bed exercise video, where you would just hold it here. And so now I'm getting isometric hips while I'm getting movement at my knee, or what we call isotonic movement at my knee. So this one can obviously be a little bit harder. So if you're able to do it, then great. If you need something to stabilize your hips a little bit more, then just doing a leg extension in a chair could also be a good variation. So you can definitely do them from this position as well. And this is just general range of motion. You're going to get a little bit of strengthening with this, but not a lot, because you're really only lifting the weight of the lower leg. But when you've got a painful knee, sometimes it doesn't take a lot of weight. So, even doing something like this could be a starting point, okay? And the more supported your thighs are, so if you have a deeper chair, it's going to be even easier. And the farther out you are, the more you're asking those hip flexors to hold your thigh in place here. Because if this muscle didn't kick in, your leg would fall down. So you're actually isometrically working your hip flexors a little bit on this. And I'm sitting on something a little unstable just to give myself a little bit more lift here, because if the chair's too low and you're doing quads like this, it just kind of gets a little awkward. So sometimes you might need to put a couple of, even a folded blanket or something to give you a little more lift if you're a little bit taller, and that can work out pretty nicely as well. But this is, again, just a simple quad extension. Now, if you have seen my mini band leg video, you'll probably recognize this exercise. Now, the band is obviously trying to pull my feet together, so by not allowing that to happen, I'm working my hips, which is a pretty nice feature of doing these leg extensions with the band. Now, what I can also do is straighten my leg one at a time, and so now the band is trying to move my leg in and pull it down, so I actually have to work my quads quite a bit harder when I'm using this band. So it's sort of like having ankle weights on, but also in a way that engages the hips. So this is just a really cool exercise. Now, you can even make this a little more of a partial range in the beginning too, but if you move your feet back more, you're going to get into that knee flexion a little bit more. So if you're able to do that, then great, but if that pushes you too hard in the knee department, remember it's always muscle working, not a lot of pain per se that you want to be feeling as you're doing this stuff. Now, for many people, it's this inner part of the knee, or what we call the medial compartment, that wears out as the knee becomes more arthritic. So if you're a little bit older and you're having more kind of that inner knee pain, this variation might not work extremely well, because it is going to be closing down that inside part of the knee a little bit more. And so what you might want to do instead, so what I've done now is, instead of having the force coming in this way, now the force is coming a little bit more from the outside. And so now what I'm going to do is I'm going to lift up my leg and try to also kind of bring it in just a little bit, okay? Now it really works those adductors, which are your kind of thigh squeezer muscles, and the quad at the same time. So if I put both feet in here, I could do one side and then the other. This is actually a really cool exercise in its own right, even for those of you that don't have knee pain. But what this will do though is transfer that force a little more towards the outer compartment, so it might alleviate a little bit of that inner compartment knee pain for some of you that are having it. And again, you may not be able to use a whole bunch of resistance on this one, because this is a pretty hard variation compared to when it's just a single band. So try that out if you're looking for some progressions, but if you're not there yet, again, just doing body weight for now is certainly a fine place to start. Okay, so once you're standing, now you're starting to add that compression back in to that tibial femoral joint I was talking about. And so again, if it's more meniscus related or related to pain in that joint, the standing stuff is going to be a little bit harder on it. So without doing a lot of deep knee flexion like you might if you're going to do a squat or a lunge or any of that stuff, you can just start with a simple exercise. And this is something you might be familiar with if you see my deadlift video. So check that out, because it's actually got some pretty cool variations of what I'm going to show now. And so what I'm going to do now though is I'm just going to do a simple hip hinge. So my knee's not totally locked out. I have just what I call a soft knee. So I just keep my knee, slightly bent. I'm not really going into a deep squat right now. And I just come down to a target that I have. Now this could be higher. I could have a target that's maybe up here for now, and just try to go there if I'm pretty unstable. And obviously I can start to go a little bit lower as you're getting more confident. But that can be a really nice way to start to work on some knee stabilization and just kind of that, what we call a sagittal plane, or just kind of that front and back direction. So again, I'm just, basically doing this. Only in this case I was using that target over here. But this is just a nice way to really work on hip stabilization, also works some of those knee stabilizers and ankle stabilizers. So that's a nice exercise that kills a lot of birds with one stone and doesn't put a huge penalty on the knee, which is one of the reasons why I like it so much. And so obviously you can start to make that a little more complex and a little higher level, where you can start to incorporate some jumps and do all kinds of different higher level things as you're feeling better, and then maybe eventually getting back to doing the squats and the lunges and all of that. But for those of you that aren't there yet, this is a pretty cool place to start. Okay, so that's just some simple strategies on how you might be able to start reducing knee pain. A lot of different causes of knee pain. So again, the caveat is always, when in doubt, get checked out. Certainly there's different types of sciatica that can sometimes masquerade as knee pain. There's other things that can be going on sometimes that aren't going to be a simple quick fix. So if you've got a lot of arthritis or a lot of damage in your meniscus, or maybe a lot of arthritis behind that patellofemoral joint I was talking about earlier, those are things that are not necessarily going to be fixed so easily with exercise. Now, many times getting better muscle support around the knee, say strengthening the quadriceps, hamstrings, the hip, as I talked about, oftentimes that can help. One of the first lines with knee pain is glute strengthening. So even if I didn't really know what was going on with somebody and I knew they had a bad knee, the glutes are definitely always good muscles to go after, and that's pretty well supported by the research. Now, sometimes you're going to have pain in one part of the knee that might require a different protocol with pain in another part though too. So if you're really scratching your head on this and it's just not helping, then obviously get checked out. Most of the time though, again, the pain does tend to come a little bit more from that tibial femoral joint, which is the one between the two long bones, the femur and the tibia. And so the compression is going to tend to be what beats that joint up a lot. And so many times that's why people that were runners kind of turn themselves into cyclists. Because with cycling, you get more what we call shear force in the knee, which actually tends to be a little bit better on knee pain many times, because the meniscus tends to like shear force a little bit more than compressive force. And again, the meniscus doesn't have a good blood supply, so it just doesn't heal as well as bone does. And that's why knee pain can be so problematic for people, getting a lot of injections and fillers and different things for meniscus pain, and then ultimately sometimes needing a knee replacement. So again, this is some simple stuff that can work pretty well. I've had good results with it, so I definitely encourage you to try it out. As always, leave me some comments below and let me know what you guys think. Definitely like and subscribe if you like this stuff. And as always, I hope you guys have some fun.